I actually had totally by chance early exposure to Gynonc after college. I ended up working as a research coordinator in GYN oncology at a hospital in Boston, and pretty quickly fell in love with it and decided that it was what I wanted to do. And that kind of stuck through medical school and residency. But I think just seeing the opportunity that you have to develop these really special longitudinal relationships with patients and be with them through really challenging moments in their lives, and then also the ability from a medical standpoint to do chemotherapy, do surgery, and be involved in really interesting and always evolving research was really cool to me. I really wanted to be at a place that had strong clinical and surgical training and also really strong research training, but it was really the people that kind of spoke to me on my interview day. I think the connections that I felt like I had with the faculty and with my now co-fellows just felt really special. I wanted to be at a place that really valued teaching of trainees and also who they are as people. I wanted to be a part of a place that I felt a part of a community, and I definitely feel like I've gotten that here. The first year has been great. So the first year is mostly research. The first 2 months are clinical, which is a big change, a lot to adjust to, but a lot of people to support you through that time. And it kind of really rapidly acclimates you to the division and getting used to the hospital here. And then research year has been great too. I think it's a really good mix at this program of dedicated research time, but also still getting some clinical exposure. I think other programs do that differently, where some places you don't get almost any clinical exposure in your research year, which I think makes for a challenging transition when you do go to clinical years. So I've been really pleased with the first year. I have two main projects. The first project, I'm working on developing a pilot study to try to get a better sense of the cognitive impact of chemotherapy for patients with ovarian cancer who are undergoing neoadjuvant chemotherapy. There is a lot of literature about the cognitive impacts of chemotherapy and all the different factors that might contribute to that for different cancers, but the literature is really heterogeneous, and there's actually almost hardly any data for ovarian cancer patients. So I'm really excited about this project to get a little bit more information about this problem that really affects our patients in a big way, and hopefully figure out things that we can do to make that a little bit better for them. The second project is looking at uterine serous cancers. So one of the pathologists here actually identified this biomarker that's associated with improved prognosis in one of the rare and more aggressive subtypes of uterine cancer. So we're looking to see if for those patients who express this biomarker, if we can safely de-escalate adjuvant therapy for them. I think everyone is really engaged and wants to know how the fellows are doing in our lives generally and also at work. I think everyone is really dedicated to making sure that we are well trained and to contributing to our education, whether we are rounding on the inpatient service or in chemo clinic or in the operating room. They make sure to continuously kind of share all the pearls that they have. And people are also really engaged in what's going on in our actual lives. I feel like people are constantly checking in to see how I'm doing, see what's new. And it feels really nice to have that relationship where I know that people really want me to succeed clinically and in my career, and also just as a person. I think the division is really thoughtful about the composition of the fellowship training and all of the experiences that we get exposure to and the support that we get for things like research and also with clinical training. And although I'm still at the beginning of my fellowship, seeing kind of the growth of my co-fellows and seeing how much the second year co-fellow knows and is able to do, and then the third year fellow after that, I have no doubts about that process and how well they're training people to leave this fellowship to do really whatever their goals are. Recent fellows have graduated and gone into private practice and worked in more underserved communities, and other people have gone on to work in academic medical centers and had really research-focused careers. And from hearing from those people, it sounds like they've all felt really well prepared to do any of those things. I think that things that are unique about this program are the really good balance during research year of still getting some clinical exposure during your research time, but not having so much clinical responsibility that it detracts from what you're able to do from a research standpoint. But you're also not just off in research land for an entire year and not having kind of any access or exposure to clinical medicine, which feels good that you don't kind of lose touch with those things for a whole year. I think we also get a lot of exposure to chemotherapy administration. And I think especially in the world of GYN oncology today, where there are constantly new targeted therapies and changes in treatment, getting a lot of exposure to that as a fellow, but also in a way that doesn't feel like it takes away from your surgical experiences, again, feels like a really good balance to have. I think Madison is a great city. It's super active. People are constantly outside all year round. People are biking out on the lakes, whether it's ice fishing or boating, whatever the time of year is. There are constantly festivals going on in the warmer months and sometimes in the colder months too, and a really good food and drink scene. I think there's kind of just something for everyone, and it's kind of nice to feel this community and that there are always people doing things around. I think it's a cliche thing to say, but I think the people are what make any program really special. And here I have felt so grateful to be surrounded by all of the people that I am. I think I have developed really close relationships with my co-fellows, and I'm so glad to have them as people who will continue to be in my life forever. And similarly with the attendings and just all of the people that we work with, the residents, I feel like we have a really good relationship with. We have an amazing APP team, both in clinic and in our inpatient service. We have just so many really good people on our team who are really invested in making sure that you do well.